Chandra to put. Hi, Chandra. And
Hey, Kakul.
so it's such a pleasure to have this chat on a Friday evening of a topic that's so very pertinent, which
Yep.
is around M&E for social impact. And I know, Chandra, that we have circulated your profile, but very briefly introducing Chandra to the group here. Chandra, more than anything else, I think represents a very, very rich experience social development specialist with over 24 years of experience, which spans foundations, international NGOs, multilaterals across domains, across very different contexts and thematics. And he brings with him a very, very rich perspective coming from this lived experience as a social development expertise. And currently, Chandra is the CSR head for Sun Pharma. A very, very warm welcome to you, Chandra.
Thank you, Kakul, and I really thank you for such a great opportunity to interact with so many of them, almost 86 people out there. And anything for ISDM, I think the institution is doing some phenomenally good work, I would say, which is very, very strategic for this particular sector.
Thank you so much, Chandra. Chandra, without further, okay, I do hear there is an echo coming from Sampada. Sampada, please let us know if we are audible now. Is this better? And we'll proceed and we'll keep track of this. So, Chandra, today, the whole concept was I will request the team to just check on the audio and the settings. I know everything is good at my end, but uh, okay, thank you so much. I do see Prithviraj saying voice is fine, so we will proceed. Um, when it comes to monitoring and evaluation for social impact, Chandra, what I thought we'll like get into it straight away. Um, and the reflection that I have is over the last 2 decades plus of your experience and from your current vantage, how have you seen M&E really evolve for the social sector? Where does it stand today and what does it mean?
Fantastic question. Thanks a lot for this. I think, from counting the activities that used to be the major focus. How many camps did I do? How many people did I reach? Right. Today, I think the entire focus is on results. I see, my 26 years of experience has taught me this. 1998, when I started off, we were counting, I was in public health, looking at HIV prevention projects. We were looking at how many condoms did you distribute, right? How many awareness sessions did you do? People were very happy with that kind of information. But today, if in case I report the same thing, they all would laugh at me, right? The entire focus would be, if I really go back and say, it will be on number of people who have visited STI clinics for treatment. That's not it. They would say how many people took the treatment and completed it. Look at this. The entire metrics has changed, right? From being a kind of activity counter to result orientation. That is what I see as a great change. If you also look at from a CSR standpoint,
Yeah.
CSR in the beginning, one decade back when it all started, it was all again, it was a compliance fulfillment thing. Okay, activity paisa diye, you got it, and then you're happy with it. But today, the entire CSR is focusing on sustainable outcomes, which has to be cost effective, scalable, replicable, and whatnot. That's
Yes.
what I've seen. And secondly, the investments that is being made uh, today is thoroughly based on research.
Yes.
Research on the needs and aspirations of the community. Earlier, probably somebody would have thought, okay, program karenge hum, okay, investment kar lo, khatam ho gaya. Needs assessment, yes, used to happen. I'm not saying no. There are really some good organizations right from 50, 60, 80 years ago, they were doing all these things. But I can't really say the same thing about many organizations, majority of them, right? That's a change that I've seen. There's a vast difference. I'm just oscillating between the NGOs and as well as the CSR sector, right? Now, within the CSR, if you look at the committees way back when it all started,
Yes.
it was mostly a fund approving, committee,
Yes.
right? But today, that is not the case. I've been attending, board meetings now almost for now 6, 8 years. Wow, the kind of questions that are being asked, they
Yeah.
all ask for social return on investments,
Hmm. Yeah.
right? That is what I have actually seen as a change. And one last thing, and I'll let pause, is the use of technology.
Yeah.
Those were the days when we still used to use pen and paper, and we used to use Excel sheets. Today it is all automated, and that's the kind of opportunities that we. That's the huge change. I would say tectonic difference.
Yes. In fact, that that's so true, I mean, what you said about how the movement has been from a very activity input orientation to what's the
Uh,
impact from the aspect of how to use technology and even the investment, which is not investment just of funding and approving, but how invested are we in getting the needle move. And that's like a perfect segue for me to delve into the second, reflection. At ISDM, we had this amazing convenings and conversations with various kinds of social purpose organizations. And like you said, it represents the entire social sector ecosystem.
yeah.
So, right from implementing NGOs to enabling intermediaries to funders and various kind of funders. Um, there is this, anecdotal conversation that comes in. Is M&E an impact assessment a tool that the funder wants to use to present to the board, to present to the stakeholder, versus this, this perspective of the balance of how to use M&E that the NGOs truly want to use? So, key point is this balance between accountability, reporting, and kind of, if I may use the word, posturing in certain platforms. So for you, monitoring and evaluation dynamics between a funder and an NGO, where do you see the balance? What's the win-win?
Oh, I think that's a beautiful question. Now, who drives what,
Yes.
right? And that actually helps people, think of certain actions, right? Now, let's look at the purpose. For a funder, he or she needs to be answerable to the committee, right? And for implementing organization, it has to be answerable to the communities to begin with, right? To its own board and to the funder. Now, in both the at both the stakeholders level, data becomes very important because in God we trust. All others will have to provide data, right? So, given that, I see. I really don't want to put a funder at a higher pedestal than a lot of NGOs saying that the funders understand M&E and not the NGOs. As I told, I've come from this sector. I've seen both the worlds, best of both the worlds, and I worked with organizations where NGOs where the M&E was the strongest, and the funders have learned from us and they replicated projects with other NGOs. And likewise, there is to be positive. I think there is a great deal of cross learning that happens. I want to acknowledge that first, right? And having said this, the grassroots organization, because of lack of resources, that includes money and human resources, they don't have or they have limited capacities on M&E. Not that they don't have intent.
Yes.
Okay, that's one category. There are other category where there is a lot of resources, but there's no intent at all because they're scared of accountability and transparency. See,
Yes.
that is where the funders play and getting things done, right? But any organization that's worth a pinch of salt would definitely like to have M&E systems in place. Because otherwise, just imagine I'm going to be riding my car with a dark glasses windshield and without a rear view mirror. And who would know where I'm going?
Yes.
Right. So now if you ask me how can there be a win-win situation, is that uh, do both the organization, that's funders as well as the implementers, know the end game,
Yes.
right? If they don't know the end game, then both of them will not give any credence to the M&E. They will
Yes.
still be looking at activities, right? So I would go back and say, what does the project design tells us and wants us? That is
Yeah.
where everything starts. I think, to be fair to the NGOs, with good training and system strengthening and use of technology, any organization with right intention will adopt. I don't think there's any resistance on that. But people who don't want to, they'll always find excuses. The big excuse that I have seen, I heard, I also hear even today is that, sir, hum to field ke log hai, sir. We are people from field. We know how to work. We will only work. Don't ask us for any reports. अरे
Yeah.
ऐसे थोड़ी होता है.
Yeah. Yeah.
बच्चों से भी हम मांगते हैं ना कि अच्छे पढ़े बच्चा, ऑल फाइन, बट वेयर इज द मार्क्स कार्ड at the end of
Yeah.
the day. So everybody has to show evidence, as simple as that.
Absolutely. No, so resonate with that thought, Chandra. In fact, if I can quote, there was a webinar we were doing in a separate context, which was on compliance and regulations and to partner with CSRs. And like you said, the person, I mean, she was heading CSR for Caterpillar and many corporates, and she mentioned something which was so interesting, and that I am assuming is the hat you also wear, which is what you alluded to, that the responsibility and accountability steered, not as it's to the community, it is to the partner, and it is to the corporate. And end of the day, in the current compliance context, it's a double whammy for the person who's managing the CSR, right? To kind of get all the stakeholders together. And hence, the true partnership is when both the partner, the NGO partner and the CSR partner come to the drawing board to say, hey, what's the end goal? What is the impact we are visualizing? What's the project design? And hence, how is an M&E framework going to support that end game? I think, Chandra, I'm just going to ask, and it's not a rhetorical question, but I know everyone has an answer. But from your lens, if I have to ask you, what is monitoring? What is evaluation? And what is impact? Can you just share your perspective on that?
See, basically, from a very simple sense, to me, monitoring is about collection of data, which is processed into information, wherein we derive insights for decision making to know whether we are in the right direction or not. That is monitoring to me. As
Yes,
simple as that.
yes,
Nothing more than that. Because people think collection of data is monitoring. No. Collection of right data, both qualitative, quantitative, processing that into information so that we derive insights out of it to know where we stand, what we do, what is working, what is not working. And just getting insights is of no use, right? Do I act upon those insights in terms of steering the project design, or whatever it is, right? It should lead to an action. Either it should confirm or it should say, oh man, no, you are not doing right. That is what we are looking at, insights leading to action. Now, in terms of evaluation, I would look at whether your project design is giving you the results, whether the outputs are leading to outcomes, right? The outcomes are always the changes that occur in the people, in the communities. Knowledge, skills, attitude, and practices. As
yes,
simple as that. To go one step further, whether those outcomes that the project has achieved is it sustainable or not, right? That's what we are looking at. For me, whether my project, because mine is a project, it's not a program, right? Look at the larger, maternal mortality. Can I alone change that with one small project with some 100 crores? Nothing. So the impact is about how am I really impacting the overall national figures or the state figures is what it is. Am I contributing to it? I will not be able to achieve impact from that perspective, but am I contributing
Exactly.
to it? But I'm here to achieve my outcomes. I think we have to achieve our outcomes, outputs, and processes. That's what to me is thing. I hope it addresses.
Absolutely, Chandra. So very true. In fact, again, an anecdotal reference, one says impact at societal level is changed once that intervention is no longer required. So, like you said, if MMR is reached, then you don't need to do anything around that. So, you're just contributing through your project outputs and outcome towards that larger impact. In fact, I'm going to pick up this one chat and this probe that's kind of come. It's come from Rahul, and he's written that sometimes NGOs excel at collecting and presenting quantitative data. However, qualitative data and specifically the impact of the work on behavior change, it presents challenges because it's slow and it's long term. And I love that question because that's truly one thing even we keep saying, and hence decoding myths around it. But would love to know your perspective of how to get that into the M&E framework um, as NGOs engage with CSRs. How do we put that?
I think many a times there are impatient investors who say, "Look, they think it's like coffee machine. You press button and you get coffee, and then you invest, and behavioral change happens." So that's why I said in the beginning that we need to know what is the end game, and before the end game, we need to really identify certain milestones and which are realistic. The smart
Yes.
indicators. I need not even get into that. I'm sure the audience here are very learned people. Uh, have levels of outcomes in such a manner that it is given certain time for us to achieve,
Yes.
right? 3 years is good time, but however we can't wait till 3 years to do our assessment. We need to have lower order results which leads to the higher order results, right? Once we have this and set the frequency, getting things in today's world in terms of assessing outcomes shouldn't be an issue at all. I worked largely in public health. I worked on income generation places, and also worked on self-esteem and self-efficacy with among women in terms of empowerment. We have we've been able to assess potential to change whether there is a change that is occurring towards the trajectory that we want to go. We can do it in 1 year's time. But those are not outcomes. Those would
Yes.
tell us whether we are moving in that direction, right?
Yes.
Those can always be done. There's always the mid-year assessments, dipstick assessments, and then end-year end project assessment. Yes, I think it's a combination of quantitative and qualitative. We can always do that. I think there are
Absolutely.
plenty of M&E experts out there, and with psychologists coming in to play, because there's a multidisciplinary function that happens now. Getting
Exactly.
indicators is not an issue.
Wonderful. Chandra, on that note, and I know there's a question of traditional M&E impact focus, but what I would request if you could share from any of your avatars and programs and projects, an example or an illustration where you saw M&E feeding back into program strategy or making that difference.
This is good. It reminds me of assignment that I did way back, almost 10 years back. Uh, I joined this organization as a program director, but I was also given a responsibility of setting up the M&E department. I mean, that's been, I've been very fortunate. So there's plenty of data that was available out there. So I thought, let me just analyze what's happening with the data. Because what the headline was that we are constructing toilets because the Swachh Bharat Abhiyan was happening. We are constructing toilets to address the needs of the community. Right, and we are doing about 16,000 toilets and all that. We're all good. Uh, I analyzed the data, disaggregated it for tribals and non-tribals, and presented a headline. Is that majority community, which is the socially upward community or whatever you call it, right? Uh, they had 80% of the households had toilet, only 20% didn't have. But 80% of the resources and efforts were going towards those 20%. Right?
Okay.
Everybody was just going and doing things out there. The tribal villages, the tribal wadis, Adivasi wadis as they are called, there were about 220 Adivasi wadis. 80-90% of them had no toilets. And only 10% of efforts were going there. The reason being, the, the outreach workers' own biasness. Secondly, the Adivasi bodies are not in the Mool Gaon, they are spread across. Okay, that's also another mobility issue. When this was presented to the promoter and to the CEO, they were shocked. They said, "What are we doing?" Right? Because the money was not working for the poor. As simple as that. If the principle is about making money to work for poor, then man, that's what it is. So this actually changed the entire thing.
Absolutely.
The focus then shifted to addressing the 80% of problem,
Yes.
right? So that's one thing. The other thing I want to go back to almost to BMGF project, which we were the principal recipient, was implementing a 8 million USD project among sex workers. We were reaching out to all women in sex work in terms of awareness messages, right? But the infection never came down. The STI was as is and all of that. Then you know what happened? There was a study which was done by University of Manitoba, Canada, right, and other local organizations, including us. Amazing insights we got. The insights were this: that young women, new women who got into this trade, and the older women over 45 years, they were the most vulnerable for getting infection. They are new, hence they do not know, they are more vulnerable, they get bullied. They're young, they have more client load. People who are old, they don't get clients, hence they are willing to compromise on their safety. That insight actually changed the project design. It is just because of the data insights and data science that we were able to manage. And then from 18%, it came down to 5%.
That's right.
That study is on in public domain, IBBA study.
Okay.
Yeah.
So wonderful. In fact, related to this, I'm just adding on an anecdote from my experience, Chandra. Um, Again, in 2000, even I was working on NACP2 project, and that was with the government. And I
Yeah.
remember one of the data research threw up while the high risk workers, the truck drivers, I mean, there was a high risk group that was identified under the mission who were targeted for interventions. But
Yeah.
interestingly, at that point of time, IT was on a boom and it led to a lot of mobility amongst IT workers.
Yeah.
And believe it or not, along with NIIT and UN AIDS in those days, we had piloted an intervention on HIV/AIDS awareness for mainstreaming HIV/AIDS awareness for the IT workforce.
Yeah.
And it was a peer because it never ever came up. And this was again thanks to a research, like you said. But yeah, I mean, reflecting back. But that's really very useful and to kind of drive home this importance on M&E and how data can be used to define program strategy. Um, you mentioned something in the beginning that how M&Es changed to come from an activity input level to how it can drive results and impact. Uh, in your view, changing this mindset of driving results based impact, and result kind of broadly, if I have to use, is something which is a significant change that has happened. So changing this mindset in program design and hence M&E, how's program planned, how's program managed, keeping always the lens of this mindset of results. How critical is that for the sector?
I think let me tell you, I've been having interaction with many funders. The change that they're looking for is funding based on outcomes that you achieve, outcome-based funding. I think going forward, philanthropy or any of the CSR would be largely on the Swiss model of contracting. You finish, you're laying the road faster, you get incentives. You delay it, you get penalized. I think that kind of model is going to come, and there's already thinking around that. You achieve outcomes in shortest possible time. You get extra money. You don't do it, you don't get it. But of course, the base money would be always be paid. So, given this, the thinking that's happening, it is very, very important that every organization, the NGOs, the SPOs, the funders, and all of them should start thinking about making M&E as a second nature. I don't think there is any if and but whether should I do it. It's about how soon you can do it and how well you can do it is the question. That is going to be critical. And in fact, the proposals that I request from NGOs for funding, I always ask for a dedicated chapter on M&E,
Yes,
very dedicated chapter on M&E, right? And without outcome framework, I don't accept any proposals,
yes,
nothing at all. And only when I look at all of these things and I'm satisfied, only then I look at budgets. Until that, I don't even talk about budgets,
yes.
nothing at all. So, given that, it becomes very, very important. I mean, I can't really emphasize any further than this.
And with this trend increasingly on the uptake of outcome-based financing, as you mentioned, would love to know from you your thoughts on what are the capacities that the NGOs or the talent in the sector um, need to kind of work upon, and from that aspect, strengthening M&E, strengthening program planning and program management, a results-based program management. What do you think about that? Do you see there is a need for that? Do you see there's a need for upskilling? I mean, obviously, like ISDM does a certification program on results-based program management, but just keeping that aside, would love to know your thoughts basis what you've seen and having been on both sides.
I think in terms of capability enhancement at DSPO and slash NGO level, I think the first point is that we all will have to resolve and then accept the fact that M&E is an integral part of project implementation, project design, and it cannot be outsourced to anybody else. Especially monitoring, strict monitoring, credible monitoring is very, very important. That has to get in, and then they should be brain tattooed, if I may use that word. Secondly, I think the social impact organization should think that M&E is both an art and science.
Yes.
That's very important. They need to approach this from both heart and mind. One of my boss used to always say this that NGO should have a social heart and a business mind.
Yes.
Right? I mean, both the things needs to work. I can't just say, look, I with good heart I'll go and implement. I don't expect the results. See, Krishna Bhagavan said that for a reason. But as an NGO, I can't say that. Or as a funder, I can't say, मैं दे करूंगा, देखेंगे क्या होता है results. No. We need to have results in mind and then start working. So that's very important. And invest in collecting evidences, analyzing, and making sense of info for decision making should be part and parcel of all our work. And use of technology for data management. I think these are some of the capabilities that has to be there. That's basic. New
Yeah.
age organization will have to have this. Otherwise, in fact, I don't go to any organization which doesn't have these things. Let me tell you, I mean, from my perspective, that's very important. Of course, the given thing is that they have their expertise in domain knowledge, they're credible organization in terms of financial systems. All that is given.
Yes,
Along with that, this is very, very important for me.
that's right. No, it's so interesting you say that, Chandra. The fact that M&E needs to sit so fairly inside the setup and inside the program intervention design per se. In fact, it's a best practice that I'm going to take away when you said we call for a chapter on, outcome framework. In fact, at ISDM and when we were looking at this design of our certification program on program management, results based program management, one of the first things was going back to the first principles of intervention design keeping the four levels of results in mind. And what does that mean? How do you design the intervention? What are the steps around this, and how do you plan for it, and then how do you kind of manage it? And then, like you said, the data management, the technology management, the knowledge management around it. So, to that point, specifically, let's talk a bit more about technology and the use of technology in M&E and the entire life cycle. Are there any best practices, recommendation, insights that you would want to reflect upon in this entire life cycle of program management and especially M&E? And any recommendations on tools that you have seen work?
I think, technology to me is a means to an end, right? Not an end in itself. So that's one thing I want to make it very clear. To me, what is very integral and the heartbeat is the project design with clear results frame,
Yes,
right? Once that is in place, then we are talking about tools to collect data, tools to analyze data, and also data visualization. Right? These are three
yes,
three simple things that I'm talking about. There are customized platforms that one can have for their organization. There are certain, software which are just plug and play. You need not even do anything. You can even just get it and then start working right from day one. I think the new age technology organization which are providing such services also have a social perspective, and they have social specialists in their own software development team. So to that extent, I would say 80% is already out there, right? So I don't think there is much of an issue, but of course, it's going to cost upward 10 lakh rupees, and then for 2 lakh rupees for a period of, I mean, every annual
every year.
year. And data visualization, you have Power BI, Tableau, and all of that. That's fine. And any people do use a lot of R, SPSS, Strata, and all of that. I mean, I think these are tools which are plentifully available for data analysis. Data visualization is so easy to learn. I myself, kind of, I'm also half fossilized already, but I learned Power BI just in about 4 days with 3 hours each
That's right.
a day. It can be done. It can be done.
Absolutely.
It's not an issue. I think plenty of technologies out there.
Absolutely. I think the principle for everyone in today's context is we have to be lifelong learners. That's how we
Yes.
stay relevant. I think
Simple.
that's going nowhere. Um, you know, while you were talking, Chandra, it was very interesting to see that how we unpack the use of technology. How do we unpack that in the context of the domain and in the context of the project that you're doing? But coming back to the point of resources which you mentioned, do you see any trend in funders being open to supporting non-programmatic funds around these foundational organizational capacities, be it in talent, be in technology? Do you see any conversation happening in the funder circuit around that?
I'm not seeing that much among the CSR per se, but at least the other traditional funding in the bilaterals and multilaterals, and other philanthropy houses, they do support on capacity building.
Yes.
See, I am today who I am because of good funders out there who supported our capacity building program. Because one of the component I used to always ask for is on capacity building, right, for my team members. That's one. Secondly, also on technology and on M&E.
Yes.
Uh, I don't see that coming very forth openly from CSR funding. I mean, I have not seen that component because we're a bit uh, held back as far as funding the M&E is concerned. But of course, on evaluations, they do fund because that's
That's
the
right.
compliance requirement. But otherwise, on domain related capacities, yes, to an extent.
Do you think the needle could also move if the NGO partners go to the table with the ask and talk
Yeah.
about it and make it
Yes.
part of their program design?
Yes, it does. It does help a lot if they do. Because at the end of the day, what does a CSR house need? A CSR program needs a leader. Is that a credible data, right?
Yes,
Instead of he or she struggling for it, if the NGO offers a full suit saying that, look, I'm going to implement your project of 10 crore worth, right? I need less than 10 lakh rupees to set up a M&A system. Why don't you help me with this so that you get real time updates? See, at the end of the day, what is the value addition that you are doing, Kakul, when you take my money matters,
yes,
right? If you're going to add value to me and to my work, I think the CSRs would be happy to make that investments.
absolutely. Absolutely. The reason I bring this up is maybe, I don't know. I mean, I'm putting it out there. Maybe a lot of times there are preconceived notions on both
Mm.
sides, with respect to the policies, the CSR policies, the restrictions around the funding pattern versus how to see and channelize that. And having an ask, which is, like you said, very rightly said, is so integral part of your program ask that you put it as part of your program ask. And hence the conversation of this trust, accountable, transparent conversation between two parties to kind of say how can we kind of align that. I
Yes.
must say, recently, very interestingly, there's a proven correlation of an impact study that was published by ATCF recently, which is the impact on capacity of a good program and the impact of that program effectiveness on not just the individual, but on that organization. And by way of the organization, the sector at large is something which truly there is a positive correlation one sees.
Yeah.
So I know, I mean, Chandra, I absolutely know your complete action bias toward being proactive on capacity development and being a lifelong learner, and that's I truly acknowledge and appreciate that, and that's something we take away to kind of translating a leader setting tone for everyone to kind of take that up in their sphere. Um, I do have a couple of questions. Why don't we take that up before we go into further reflections, Chandra? There is a question posted by Sagar which says, what are the key differences between traditional M&E and impact-focused M&E?
I don't know. See, to me, I only learned one M&E, right? That M&E which focuses on insights for decision making, right? That M&E which is smart, right? That M&E which is credible. That M&E which actually believes in ethical reporting. When I say ethical reporting, it is as is reporting, right? The M&E which focuses on what did I do well, why, and in what context. What I did not do well, why, and in what context. Hence, if I have to do something new, I mean, what will I change? And hence, what are my learnings? To me, that's M&E. See, I would say M&E has evolved based on the understanding practices and more importantly, intent.
Yes.
I may be knowing everything about M&E, but my intent is not to be accountable and transparent. I will never implement, right? So it is just about one M&E which is effective and which adds value to the community, to the implementers, to the donors, and to the stakeholders and to the government. That's my personal take.
Truly love that. So very true. Um, and I'm just sharing again a reflection here. There are dashboards and there are reporting dashboards.
Yeah.
Many a times, the lens of the dashboard comes from who's viewing that dashboard, and the dashboards change.
Yeah.
So at various levels. What you say is so powerful because If the alignment on the shared purpose and impact is there, then it's the same level that is going. So, and at that point, in fact, if I can just nudge you to share that, at what stage does the outcome framework, M&E plan, and how it's going to be used, at what stage should the organization be deep diving into that and planning for that?
See, to me, I would start a project with an end in mind, which means the outcomes, I will be very clear what I'm going to achieve right from day one. The question is about when I'm going to achieve, right? Now, the point here is when is basically outcomes will have to be given time 12 months to 18 months to 24 months to 36 months, right? But day one, I'm very clear. Now, for example, I'm implementing a advanced cook stove project, right? I'm very clear. The outcome is the indoor pollution reduction, thereby improving the health of mother and child, right? Reduction in drudgery of women because of less firewood being collected, right? The third thing is reduction in time spent in front of the stove because of efficiency of the stove to cook faster,
Yes.
right? I'm very clear about these things.
Yes.
Right? I mean, I just finished distributing about 3,000 cook stoves, and next year I'm going to do about 8,000. We're investing over 3 CR in this. We're very clear. Now, with this as an intention, we are distributing. I'm not going to assess this in the first day itself, but I know the baseline. Baseline is already done.
Yes.
Now, after 1 year, I'm going to go back to them. There are going to be two things. One, I'm going to claim carbon credits.
Yes.
Okay, then I'm going to also look at the other outcomes. Simple.
Absolutely. Absolutely. And the power of, identifying what is the end goal and hence what I'm doing towards this end goal. So
Yeah,
in a way, your monitoring is kind of following you here in terms of your activity and the data to say that is it kind of going there or not?
yeah, 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 yeah.
Absolutely. And from that aspect, in fact, again, just kind of bringing in a reflection, Chandra, and this is in the context of MMR only. I mean, they were not naming anyone, but there were this intervention on mobile health clinics, which reach inaccessible
Yeah.
areas of hinterlands. And the whether you are saying how many consultations did I do? So the number, the activity. So how many people came in for consultation? And if that becomes the goal, the person who's there on the field and kind of doing the consultations, talking to the person, and maybe the goal is to increase institutional deliveries, identify high risk patients, identify what can be done, but that may get diluted if all that your focus is on how many numbers did I do today versus did I give it that time and did I probe effectively to identify and do diligence to that particular activity. So, hence just kind of qualifying and quantifying what does it mean when you know the end goal that we have in mind.
Yeah, absolutely right. See, you only do things what you monitor, right?
Yes,
Tomorrow, ISDM says it's going to monitor people coming in right time and then going off at right time. Then they'll come, they'll go. That's it. They will not do anything in between. But if I look at focus on the productivity of the day, that's where the focus is, right? Because that's where the behavioral change happens.
absolutely. Absolutely. Okay, I'm going to pick up the second question, which is please reflect on the use of SROI in the evaluations, given the fact that several assumptions are made in the calculation of SROI.
Yeah. In fact, let me admit, we are still trying to crack at it. I mean, in fact, I should thank ISDM for giving us some fantastic facilitator. ROI is pretty easy to do it, right? We can somehow assign value and then do it. But in terms of, social outcomes that we have achieved, for example, because of my intervention among SHGs, there is an increase in self-confidence among women.
Yes,
How do I really assign a value to that and then get things done? I mean, I'm actually breaking my head on this. This is going to be my next frontier that I want to conquer. I mean, of course, with help of ISDM and then with few other experts. I want to really look at, women's ability to participate in decision making on financial matters at home, which otherwise she was not doing. After her intervention, she did it. Right now, how do I assign a value on that? It is still a gray area, at least for me. I mean, I don't know. I mean, I'll be happy to learn from the participants here. Is there anybody who has got a great experience of doing this? It is a tough job because we have to really have a lot of assumptions, assign a value for self-esteem, and then basis that assumption we have to then calculate. Right? It is very subjective at the end of
That's
the day.
right.
At this
That's
point in
right.
time, at least.
Absolutely.
Yeah. I'm,
Absolutely.
I'm so sorry. I don't think you really stumped me with this question, boss Indiraji. But it's a great question. I'm also trying to explore. Together we can learn, exchange notes.
Great, absolutely. That's so true. There is a question which says which aspect of M&A will enable identifying the impact besides the outcome?
See, the point is, no. Again, we have to go back to the basics: the attribution and contribution,
Yes.
right? Our basis that we can think of. I think it in itself is going to be a huge, discussion. Impact you can only contribute, you can't achieve, right? If I'm doing a RMNCS project and within my own areas I've improved institutional delivery, which means you are contributed to the overall reduction of MMR and IMR in a manner, in a manner, right? Uh, at a India level, if it is from 46, it has come down to 20. We can't just say that it's because of us. We can say we have contributed to it. In itself, is a very different ball game. But I would normally, my perspective is that when I do projects, I look at outcomes which are within my own control, within my own project area, and take it forward. And wherever resources permit, I do randomized control trials. Again, it has got its limitation, but it is much better than something else, right? We can completely control all the factors, but still randomized control trial comes closer to reality. So that's what we do. I mean, that's what I do. I wouldn't really look at breaking my head on the impact per se. Outcomes is what I would look at.
In fact, Chandra, I just so love the authenticity of the response. I must kind of put it out there. Uh, impact, as I said, it's going back to the first principles of what we're trying to do and hence what we are achieving towards. And sometimes it just we get caught up with the concept and the thought of it. We are all contributing to that and hence focusing even on getting the outcome right. Sometimes even outputs and outcomes are so very powerful in the journey to impact. But getting that right without getting trapped in the impact narrative per se is so equally important. There's this question, I think we did reflect upon it earlier. In what ways can effective M&E help programs stay aligned with their intended outcomes and impact? I think you did allude to that, but I'm just calling out on that question.
Yeah, it's basically a clear windshield and a rear view mirror for us
Yeah,
to know what we have achieved in the past and then where I'm going. I think M&E is your eyes, M&E is your ears,
yeah.
M&E is your insights and intuitions. Just imagine you don't have any of those five senses working for us, just the heart out there. We'll have only love. That's it. No impact, no outcomes. So we don't want love which is not impactful.
I'm going to quote you on that one, Chandra. uh, yeah, absolutely. Um, in fact, to that point, let me ask this question, because ISDM, we keep saying, a lot of times capacity building is very domain specific, you know.
Yeah.
Um, but we feel that fundamental management strands and kind of curating um, programs, capacities around using management strands, such as monitoring evaluation,
Yeah.
scaling programs, etc. using data and technology, systems thinking is very important. So I mean, do you think kind of doing a certification program on results-based program management, which includes M&E, is something that professionals who've been working in this sector for the last 10 years, would it be worthwhile for them to go through something like that?
100%, 100%. I think, see, one is domain knowledge about, okay, what is, maternal mortality? How do you control and all of that? Right? How do you reduce? What is HIV? What is farming agricultural practices? All of that. It's a domain knowledge, right? It tells what to do.
Yeah,
It doesn't tell you how to do.
yeah,
And it also doesn't tell you how efficiently you are doing.
yeah,
Right. I think, as I said in the beginning, that it's an art and science. One is, of course, you need to have domain knowledge. There is no compromise on that, right? Having had that, fulfilled, it's also important to understand management. See, management is about art of getting work done.
yeah,
In simple layman's sense, right? What is project management? It's about art of getting work done, art and science of getting work done. Here, it's about how do you really make the extremely scarce resources deliver the highest possible output outcomes
yes,
with your domain knowledge. There is no alternative to domain knowledge. Both has to be married. It is always useful. It's always useful. In fact, the bilateral funding agencies like the GICs of the world, TTH, DFID, then Department for International Development UK,
yes,
USA,
ISDM.
UN organizations, they were all investing on project management trainings for the NGOs. I'm
Yeah,
one of their product. Let me tell you, I thank them. I mean, my stars were all aligned. Hence, I was able to understand both the management as well as domain. It is useful. It has to be done. I mean, if you ask me, there is
absolutely.
there is no two way about it.
Chandra, more power to you to carry this voice across other CSR and other funder groups as well. Um, this is a very interesting question that Shambhavi has posted in the chat, which is M&E is done only for a specific project and program, or can it be done at the organization level?
Yeah. See, now, for example, an organization is set up for a purpose, right? And organization needs to have a strategic plan, right? A vision document for next 3 years, for example. Now, in that vision document, the board members, the staff, including community, would set certain outcomes the organization needs to achieve, right? There is also evaluation done for the organization efficiencies. M&E is for organization, it is for individuals, it's for groups, it's for family, it's for everybody.
Absolutely.
It can be applied across board, but of course, many a times what happens is in the art of focusing on projects, the organization assessment, organization behavioral assessment, organization efficiency assessment actually is lost. At least, if not yearly, once in 3 years, you need to get some external agency to see how we are functioning as an organization. And every organization should have a strategic plan.
Absolutely. Chandra, just adding on to this, and this is in the context like Shambhavi's mentioned about they work in, Right to Live, is doing multiple projects across the sector. Uh, at ISDM, and this same question, it was in context of a discussion with Pradhan that rural development has such intersectionality, rural transformation has such intersectionality,
Yeah.
and many projects that have happened. M&E happens at the project level, but there is so much of impact at the organization, M&E
Yeah.
at the organization level, and also through this, the impact in at the sector, at the ecosystem level for the government partners, for the government officials, for the other NGO partners. So how does one kind of capture that? So interestingly, we are actually doing a research project collaborating with Pradhan to see if we can come up with an integrated framework on rural development, which kind of takes this view of not just projects and programs, but the organization level as well. So, and to your point, Chandra, what you said is so true. The concept is so, I think our lives are so largely led by programs and projects. However, stepping back at the organization level, even when capacities are there, they are in the purview of the projects, but not at the organization level. But this is seriously a very powerful point that does call for reflection for everyone. Okay, how has Emily evolved in the field of policy advocacy, and how is it different from other programmatic goals?
If you ask me, the principles of M&E remains the same. At the end of the day, policy advocacy is a strategy. But policy advocacy for what? Right? For example, when we were working on public health, one of the policy advocacies that we had was accessibility of the most vulnerable community to the government schemes or having specialized government schemes.
Yes,
Right? If that is my objective and the outcomes that I want to achieve, then I would start working on collecting those information to see whether, because of my intervention, has the access to government schemes improved? Have there been any specialized schemes specifically developed for the vulnerable communities out there? If yes, we have achieved our goal, right? So at the end of the day, again, I go back to the fundamentals. What is the end?
absolutely.
And end game, and then do I have I articulated it very well in terms of indicators,
Absolutely.
both quality, quantity, and time, right?
Absolutely.
The smart thing, if you have that, everything else is the same, in terms of data collection, processing data into information, gaining insights and actions and follow through.
Absolutely. I truly appreciate the simplicity with which you kind of put everything and decode everything down to the brass tacks. And that is actually so true. And that's what one reflects is getting out of the packaging and the jargons to truly go back to those concepts at the fundamental level and see how it applies to you in your context. Um, the I'm just going to check very quickly if there's anything. But in interest of time, I know we have 1 minute left. Chandra, I do want to kind of ask the last reflection from you, which is that if there were two takeaways you would recommend for the audience here on the webinar and for the sector at large in context of M&E for social impact, what would that be?
Okay. The things that has changed me is what I'm going to reflect upon. I don't think I'm able to say what they will have to look at, but what has really helped me as a professional and as a leader of an organization is that M&E is a very, very important and intrinsic to what I do.
Yes.
And I do M&E for my own self, not for others. Like primarily, I need to know what is happening, whether am I keeping the right step in the right direction, and to know how many steps I have moved, and then how far I need to reach. It is in my own interest that I need to be knowing, because the more insightful I am, then people would understand who I am, right? Being second is being credible organization in terms of finances doesn't mean I'm a capable organization, right? So being capable, of course, in domain, I need not even specify how important it is, but also in terms of systems.
Yes.
And in today's world, if anybody is giving me a rupee, they want to know what I have done with that rupee
Yes.
financially. And secondly, they want to know what I have achieved from that 1 rupee, not from activity perspective, but from a outcome perspective.
Outcome perspective.
I think world over people are talking about outcomes. And the more quicker we understand this and build our capacities and move forward, it's going to help. And M&E has helped me personally also. because I have an Excel sheet which actually tells me what I should be doing, where I need to be going. Seriously. So, it does help. Yeah.
So wonderfully put, Chandra. Thank you so much. And I totally repeat the sentiment I started with. The ending of the Friday with this chat has been stupendous. I know I'm carrying away some golden nuggets and the simplicity of the way you put things and effort to kind of put it out there for us and everyone on this webinar. Truly appreciate this. Thank you so very much to engage with us.
A lot to you and to all the participants out there for the patience. And so, of course, some of the questions have been not answered. If there's anything more, I'm happy to take them offline and then we can discuss. Thanks, Kakul, for
Absolutely.
this support, and thanks to Sanjeev as well. Yep.
That's right.
Yeah.
Thank you, Chandra.
Yeah. Bye.
Thank you so much. Bye
Bye.
bye.
Bye.